I'm Hafsa Khalil, Clinical Research Certified Professional Research Officer at AFIC and AHT. And the topic of my presentation is Prevalence of Oil and Ghee Consumption in General Population, a pilot survey. In recent decades, we have confirmed that the trans fatty acids have the direct relation with the non-communicable diseases, especially the coronary heart disease, as well as the infertility, gallstones, Alzheimer's disease, diabetes, and cancers. Globally, it is estimated that 5,37,000 deaths in 2010 were attributed to the increased intake of TFA. Trans fatty acids were responsible for 7.7% of mortality due to coronary heart disease. Pakistan is particularly the highest consumer of the TFA. Among the countries of WHO EMRO region, TFA consumption in Pakistan was ranked highest after Egypt. Very limited data is available on local population regarding the consumption of oil and ghee in our daily dietary habits. It was a published article, and the objective of this article is to determine the frequency of daily oil, butter and ghee consumption in general population. It was a descriptive cross-sectional survey conducted during the 3 months from June to August. The study setting was AFIC, MH Hospital and AFIU. The study population were normal, healthy individuals, the family members of the admitted patients in the hospital of both gender, age between 18 to 60 years. The sample size was 700 and the sampling technique was non-probability convenient sampling. A validated data collection tool, it was taken from WHO STEP survey and food frequency questionnaire. The pilot testing of the tool was performed on 10% of the participants, and Cronbach alpha of the questionnaire was 0.7, which make the questionnaire a valid tool. Ethical approval was taken before conduction of the study, and informed consent from each participant was taken before the collection of data. Results and important findings. The mean age of the study population was 43 and the weight was 69. Most of the participants had the blood sugar fasting was 1.109. Most of the study population was under the normal weight, but we have a major chunk, like 33.5% of the patients were overweight. 37% females and 63% male in this study. Most of the population was Punjabi because we have collected data from Pindi. So we should initiate the study on different provinces. We actually initiated this study, and very few participants from other provinces. Most of the participants had the strong family history of hypertension and diabetes, which is 28% and 19.5%. The history of cardiac intervention was most of the participants had stenting history and very few had valvular surgery. The mean cholesterol was of the study participant was 163, but the triglycerides level were more than the normal range. They were 183, while the normal range should be less than 150. Most of the participants were having the very mild physical activity, like 52% of the participants were on very mild physical activity, and very few participants, 17%, had vigorous physical activity. The smoking status of the participants were 5% were current smokers and around about 7% were ex-smokers. As you can see in this table, 39% of the participants use oil for the cooking twice a day, and 14% use ghee for cooking twice a day, and very low consumption of butter, salted or unsalted, both type of. Very few participants use butter in the regular cooking. The frequency of preferred mode of cooking tells us that 35% of the participants use curry twice a day, which is normally routine in our culture. 19% use deep frying as a mode of cooking twice a day, which is very dangerous. 4.6% people consume junk food on daily basis. So this table determines us the type of fat consumed per month. So mostly the mean consumption of oil in our population is 5 to 6 liter per month, and the monthly consumption of ghee is 2 kgs. So the conclusion of my finding is these findings facilitate quantitative assessment of consumption of dietary fats, and in future this survey can be used as a national and global level to alter diet, reduce disease and improve population health. And NAPCARD is the we are working on different projects. We have circulated this oil and ghee project to different provinces, to all the cardiac centers on which we are working and collecting data regarding the oil and ghee consumption in all provinces of Pakistan. The limitations and recommendations of this study, that we have younger population has more consumption of trans fatty acids than the older one. Like we knows that our young population consume more junk food than our elder community members. We should plan longitudinal studies, long-term follow-up, and we should conduct studies on the type of fats consumed, like trans fats and other types. We should prepare awareness programs for the consumption of good fats, and we should conduct RCTs and meta-analysis. Thank you.